Imagine discovering that the person caring for your mother, father, spouse, or loved one in a nursing home wasn't actually qualified to be a nurse. Not because they forgot a certification, not because they were new, but because their nursing diploma was fake. Unfortunately, this isn't a hypothetical scenario. It's a real issue that has affected long-term care facilities across the United States and has raised serious concerns about resident safety. That's my lame Twilight Zone entry. But anyway, today we're discussing Operation Nightingale, one of the largest nursing credential fraud investigations in U.S. history. What happened, why it matters, and what questions you should be asking if your loved one receives long-term or memory care. Hi, I'm Deb James, board-certified holistic nurse and dementia care coach, helping caregivers navigate healthcare with confidence and advocacy. So let's dive in. What happened? Between 2023 and 2025, federal investigators uncovered a massive scheme involving fraudulent nursing diplomas sold through several Florida-based schools. More than 7,600 fake diplomas and transcripts were allegedly sold. Individuals used these documents to become eligible for nursing licensure examinations and obtain employment in healthcare settings. Many of these individuals were hired by nursing homes, rehab centers, assisted living facilities, and home health agencies. Now, let's be clear. This does not, I repeat, does not mean every nurse working in long-term care is unqualified. In fact, the overwhelming majority of nurses are highly trained, ethical professionals dedicated to caring for vulnerable populations. But this case exposed weaknesses in hiring and credential verification systems that allowed some unqualified individuals to slip through the cracks. And when the people affected are older adults, people with dementia, people who are medically fragile, the consequences can be deadly. Why long-term care facilities are vulnerable. Many long-term care facilities face significant staffing challenges, high turnover rates, workforce shortages, pressure to fill open positions quickly, and other things. Unfortunately, those conditions can sometimes create opportunities for fraud. Federal investigators found examples where employers failed to verify educational credentials, failed to thoroughly validate out-of-state licenses, overlooked employment history discrepancies, and failed to investigate suspicious application information. When verification processes are weak, residents may unknowingly receive care from individuals who lack the knowledge and clinical training necessary to recognize medical emergencies, prevent complications, or administer care safely. For residents with dementia who may already have difficulty communicating concerns, this creates an additional layer of risk. Why families should care. As caregivers, we often assume healthcare systems are checking every credential and validating every license. That's normal. That's what you expect. Most of the time, they are. But Operation Nightingale reminds us that advocacy remains essential. Families should feel empowered to ask questions such as, how are staff credentials verified? What training do caregivers receive? What is the facility's staff retention rate? How are concerns about staff competency addressed? And what is the nurse to patient or resident ratio? If your loved one experiences repeated medication errors, unexplained injuries, poor communication, or care that consistently falls below expectations, those concerns deserve attention. Advocacy is not about being difficult. Advocacy is about protecting the people we love. And sometimes asking one important question can prevent a serious situation. What this means for healthcare. This issue is larger than one investigation, but it highlights the importance of strong hiring practices, rigorous credential verification, and accountability across healthcare. It also reminds us that quality care depends on both competent professionals and systems designed to protect patients. Families deserve transparency. Residents deserve safety. Healthcare workers deserve workplaces that maintain professional standards. And organizations must continue strengthening safeguards that protect vulnerable populations. In closing, Operation Nightingale exposed a troubling problem, but it also offers an important lesson. Never underestimate the power of informed advocacy. Whether you're caring for a loved one with dementia, helping an aging parent navigate long-term care, or simply planning for the future, asking questions and staying engaged can make a meaningful difference. The goal isn't fear, the goal is awareness. If you like what I'm talking about, hit that little bell button to remind you when there are updates to my YouTube channel, Deb RN Advocacy and Scrubs. Like and subscribe for weekly dementia care conversations and healthcare advocacy insights. Comment below, what questions do you ask when evaluating a nursing home or assisted living facility? I love hearing from you and enjoy building community together. If you don't want to leave a comment, you can contact me directly and I will respond within 48 hours. Thank you for being here, and I look forward to seeing you the next time around.